My choking episodes started getting really bad to where my family was scared to leave me by myself because it's like I couldn't catch my breath anymore.
For 15 long years, Elaine McCray felt like food was the enemy. Her severe acid reflux, or GERD, made her kitchen the last place she wanted to be.
People just kind of hear GERD and they think, take a little Prilosec, you got a little acid reflux, but after dealing with it for years, it gets so much more severe. It affected my sleep. I couldn't lay on my left side because I would get this gurgling noise and it would wake me up out of my sleep. It affected the foods that I ate.
Elaine says her doctors in Nebraska, where she used to live, just couldn't figure out what was wrong.
I had an episode that I was choking so bad that I couldn't catch my breath at all. And I was scared I wasn't going to make it to the front door to tell him, help me.
Elaine made the move to Mansfield for work. It turned out it was the right move for her health, too.
I met with Dr. Meeman, who then, when I described it, I just start crying in his office because after 15 years, everything I described, he knew exactly what it was I was saying. He gave me the name, everything, and he referred me to Dr. Parcells. And so between that tag team there, moving to Texas and finding those two was the best thing ever happened to me.
Elaine had what's called a hiatal hernia. Her stomach was pushing up into her chest, allowing stomach acid into her esophagus. Dr. Jeremy Parcells used robotic surgery to repair that.
When you're working in that space, you're working on the esophagus, but in front of it you got the heart, behind it you have the aorta, you have the lungs to both sides. So you want to be careful, you want to have better visualization, and the robot actually does have higher resolution on the camera. It's a 3D view. The instruments, as opposed to being just kind of straight conventional laparoscopic graspers that can sort of turn just like this, they have what they call wristed instruments. So instead of just being able to do this, now your instruments can sort of have an extra range of motion there.
With that surgery a success, doctors used a special device to go down Elaine's throat and into her stomach. In what's called the TIF procedure, surgeons reinforce the barrier between the esophagus and stomach with additional tissue to make sure that stomach acid stayed right where it's supposed to be.
After the TIF procedure, our regurgitation symptoms got better, and she now can tell me that she can eat whatever she wants. Ideally, that's the goal, is to have a patient have a symptom relief so they can have a good quality of life.
I don't like that I didn't meet these doctors earlier, but there was nothing I can do about it. Obviously, that's just the way it was gonna go. But I say talk to your doctors. There is help out there, and don't stop till you get to the bottom of it, because now I'm free to do what I wanna do and I'm not restricted.